I'd then like to introduce to you our next presentation, which is from Lisa Gibson from the Lincolnshire Community and Voluntary Service, who is going to tell us about social prescribing. Lisa.
Hello, thank you for having me today.
Let me get your slides on up, shall I?
Don't worry about them just for a minute. I can get cracking before we get the slides. As Richard said, I'm going to talk about social prescribing. I lead on social prescribing with Lincolnshire CVS. We cover our colleagues in voluntary centre services cover kind of Lincoln and north of Lincoln into Gainsborough. So across the county we provide one service supporting people with social prescribing, and I am going to tell you what that means in just a minute. I think first off it's good to think about how many people in our community actually feel lonely every day. How many people literally have no one to talk to, no one to share their concerns with, no one to get excited about things with, literally no one. If I just ask you to take a minute to think about your week, the last 7 days, what kind of things you've been up to, what have you been doing, where have you been going? Now, having kind of got a picture in your mind of all of the different things that you've done, take out every single person who wouldn't have been there except that it was their job. So anyone that you had, any friends that you had a chat with, any family members that you sat down to dinner with, all those people who just were there and they weren't there because it was their job. And when you think about that, you start to imagine the reality that lots of people live with every day. And we know that that leads to loneliness, acute loneliness, a sense of isolation, and that's more damaging to our health than lots of the things that we think about when we think of poor health outcomes. And so loneliness is a real issue. It's very real for the people who experience it. It leads to poor health outcomes and it actually costs the NHS a lot of money. And so now if I could have the first slide, please. I'm going to have a really quick look at why we need social prescribing. How have we ended up in such a lonely position? And then we're going to have a look at how it works in practice. So this first slide really just tells us that social prescribing is kind of it in a nutshell, really. Social prescribing links people to things in their own communities that are good for their health and well-being, essentially. Sounds really simple, doesn't it? What's complicated about that? And why do we need to worry about things like that? So if we move on, please. So I'm going to tell you about my grandparents. Towns in the northwest of Lancashire, and used to, when we were children, tell great stories. My nan used to talk about how she'd spend all morning scrubbing the house, and in the afternoon she'd sit on her very shiny step and talk to her neighbours who were doing exactly the same thing, and they'd talk about what was going on, they'd talk about the things that worried them, they talked about, I'm sure they talked about the neighbours. They talk about, she used to talk about someone down the street whose windows weren't very clean. You know, there was that real sense of kind of, let's just all muck in the afternoon, have a brew and a chat. My granddad, he worked in a foundry, and he'd talk about the fact that although he was teetotal all of his life, he would never miss popping into the pub on the way home with all of his friends, because that's where they debriefed the day. And within that community, there was a real resilience, there was a real strength. If someone had a question, someone else on the street knew the answer. If someone ran out of something that they needed, there was always a neighbour who would be able to lend them whatever it was, whether they really had it to spare or not. It was a really resilient, tight community. Now, it wasn't utopia. There were lots of things that were wrong, but there were tremendous amounts of things that were right. So strong in professional services. So professional services weren't as trusted as friends and neighbours. And then I think it's the next slide. I've forgotten what's on my slides. 1948 came along and we got the NHS, which is just fantastic. The NHS has been so amazing. It's really leveled that playing field. So whoever we are, whatever our profession, whatever our income, we have access to the healthcare that we need at the time that we need it. It's suppressed really devastating diseases. It's provided employment for probably hundreds of thousands of people. And there's a lot that's brilliant about the NHS. But what happened was, over time, probably over the last 50, 60 years, we've started to expert everything. We've medicalised things that used to happen quite well in our communities. And we have perhaps reached a point where there's a sense that you need a certificate for everything. You need a certificate, you need some training to be able to support your neighbours. But actually, so a lot of what the community used to do very well, the community now doesn't do, because it's lost its skills. We've lost our confidence and we've kind of experted everything. So it's kind of switched in that our confidence now in our community is low and our confidence in professionals is high. And that's why if we start to feel a bit unwell, we've learned over the last few years, we can go and talk to the pharmacist. But actually, it's taken quite a lot of convincing for some people to go and see the pharmacist, because we would really prefer to phone the GP. We would never think of knocking on the neighbour's door. So things that happened really well in our communities for a long time have now been kind of experted, and we need a certificate and a bit of training to do all kinds of things. I was a bit of a rebel when I came to have children and decided I'd quite like to have them at home. The area where we lived went into meltdown, and there was real consternation, and I understood why the professionals were worried by this prospect. But actually, what had been done well in the community for generations had been so medicalised that, lots of my friends, lots of professionals were saying to me, "You're absolutely mad. Why would you want to have a baby in your own house, in the community, not in a hospital?" I have to say, it worked very well twice. And the area that we live in now have a really strong offer for women who choose to have their babies at home. But there was a real conversation because we'd experted it so very much. So I guess what I'm saying is we've lost a bit of confidence in our communities, and we've put all of our confidence in professionals and services. And now we have a problem because we have a tsunami heading our way of mental distress. Levels of mental ill health are already very high, and COVID has not helped with that. We've also got things around the economy, so people are worried about their jobs. We've got things around political things, so people are worried about how Brexit might have an impact on to a real wave of mental ill health that's coming our way. The problem is we haven't got enough experts. And remember, now we're all trusting our experts. Can we make enough experts in time? The answer is no. So when we look around and we ask the question, what's strong in our community rather than what's wrong with our community, the answer is our community is what's strong. I have a theory that if we knocked on all the doors on a street and we said to everyone, can you tell me what are your concerns? What are the things that worry you? And can you also tell me what your neighbours, what you could help your neighbours with? And we made 2 lists. I think we could match those lists up pretty well. But the challenge is actually getting communities to have that conversation. And so we'll just go on to the next slide, if that's all right. That's when social prescribing comes in, because instead of having that community professional seesaw, what we try to do is we take the seesaw and put it in the corner because it's no use to anybody. We think about the person, we talk to the person, and we find out actually what's going to help them. And without question, it's always a blend of professionals and experts and people in their own community. Organisations, so it might be that they need to see their GP and perhaps there's someone in secondary care, but also that a walking group would be good for them, or a knit and natter, or horse riding, or lots of different things in their own community. what's really key is that people very rarely do well in a very isolated lifestyle. And so connecting people back into their community is really important. So if we can move on to the next slide, we're just going to think about how and the next one, that one shouldn't even be there. That was just a sneaky one. So we're going to think about how do we actually do this in practice? And the first thing that we do is we think about who might benefit most from social prescribing. So generally that's someone who wants to be active in their community and wants to access those self-help activities, because we do sometimes get asked to support people who don't want to access their community, who are quite happy with their level of engagement, and perhaps someone who really cares for them, someone who's very well-meaning, thinks that they need to get out a bit more, but actually some people don't want to get out a bit more. So it needs to be someone who's willing to and wanting to engage in their community. It needs to be someone whose medical needs are stable and managed, that's their physical and their mental health, because the last thing we want to do is kind of in a community activity which for them is not going to be sustainable, because that's almost kind of setting people up to fail. So we always want people to be able to engage in something, continue on it and really enjoy it. And people who are physically able to engage in their community. So we know that people have lots of different levels of physicality, but it needs to, ideally for social prescribing, be someone who can, if they want to join a bowls club, they need to be able to get to a bowls club and in whatever way they can engage in that activity. If they can't get out of the house, we're going to struggle to engage them in a bowls club, although we can find other things for them to do remotely. And I think COVID's helped us out massively with understanding how people can engage with activities without necessarily being in the room. So that's who benefits most from social prescribing. We don't have a kind of criteria, but those are the people who are going to get the best out of it. If we can move on. And the things that might have caused someone to become isolated, the list could be incredibly long, but we've just said someone who perhaps has a diagnosed or perceived poor mental health, people whose confidence or self-esteem has been a bit knocked, people who've been in poor physical health or bereaved, often struggle and can become isolated. And I think we all have days when we think, oh, do you know what, I can't be bothered today, or you know, just those days when you don't want to go out, and that's okay, actually, that's fine. It's when someone gets stuck in that and they support them. Just moving on. So we always start with this really simple question: what matters to you? We often on our referral forms get told all about what's the matter with someone, what's gone wrong for them, what their issue is, but actually what's most important to us is to know what's important to that person. You know, we can make suggestions, but it's only going to work if we're addressing the issues that are really significant to the participant that we're working with. So our first question is always what matters to you, and we COVID scuppered us a bit because we really like to ask that question over a brew, and preferably a piece of cake, because we think it's important to just connect with people in a space that's comfortable for them, often in their own home, and just have a chat, really. So let's move on. Once we know what's important to someone and what they want to achieve, we work on 3 levels. So it might be that they just want some information on an activity or an organisation, and we can signpost them to that. It might be that they're not quite sure what they want to do, but they know where they want to get to, and so we'll help them to work that out. We'll help them to set some goals, and we'll do that signposting again so they can pick that up, and then we'll check back in with them in a few weeks to see how they're getting on. Most of the people we work with don't really know what they want to achieve, and so they have no idea how they're going to get there. And even when we've helped them to work through that, they've lost that confidence, and so just giving them the information on activities wouldn't be any use. And so our link workers will go out and really facilitate that engagement And that might be about referring them to organisations, it might be about accompanying them to different activities and organisations that they can access. So I would say most of the people that we work with are level 3, but we certainly work with people in levels 2 and 1. Okay, moving on. So the impact, because actually this is all about helping people to experience life in a much more positive way. What we hope for individuals, for participants, is that we give them an opportunity to think about and focus on the things that are important to them in a really positive way, so that their self-esteem increases, so that they feel more connected with their community. And actually, as soon as people start feeling more connected with their community, their physical and mental health often just improve anyway. And I will tell you a story in a little while to demonstrate that. For primary care, we see a reduction in GP appointments. The early research suggested there were 20% of GP appointments that were socially driven. Some more recent research suggests there's another 20% that are related to a healthcare issue that can be supported by social prescribing. An example would be someone with arthritis quite rightly needs to see their GP and possibly their consultant, but actually if they can be referred to social prescribing and we can help them to access a yoga class, a walking group, a swimming group, to strengthen their body, then actually that will decrease their need for primary care and potentially reduce some of their prescribed medications as well. Yet we also see people, much more equipped and confident in caring for themselves. And it's really important that people know which service to access at what time. We do sometimes start to work with people who are calling ambulances a lot. And it's largely because if you imagine being chronically ill, feeling absolutely awful day after day after day after day and having no one to talk to about it, there is a number that you can call where someone always speaks to you, and we can see how people kind of fall into the trap of using 999 as a kind of a way to get some social interaction, and we see that reduce as we work with people. And for the community, of course, there are just more people engaging in their activities and an increased number of volunteers available, because we do often work with people who go on to volunteering. So this is a case study. The case study, I think the slides are going to come out after the thing. So I'm not going to go through that case study. I'm going to talk about a local case study for Stamford, because we worked with a lady who was really quite lonely. She'd been bereaved. She'd lost her job through COVID and was really struggling with her mental health. She'd become quite anxious and worried about being out and about. And actually, we know there are a lot of people now who are worried about re-engaging into their communities. And so for the purposes, I don't know what to call her, we'll call her Sandra for now, that's not her actual name, had previously been engaged with Mindspace, which is a brilliant mental health charity in Stamford, but she'd lost touch with Mindspace. So our link worker went back to Mindspace with her. They went and had a cup of tea and a chat. And Sonia, our link worker, asked her, actually, what's important to you? What do you really want to engage with? And there were a few things. So while they were having their cup of tea at Mindspace, Sandra got a new programme so that she knew what she could access there. She also talked about feeling kind of really isolated and a bit not useful. And so Sonia suggested volunteering. And they went to see about volunteering at a charity in the town, which actually didn't work out to be the right thing, but it kind of set Sandra on that way of thinking. And so they had a quick review. And Sandra now volunteers with Evergreen, who you're going to hear from next. So she's gone from feeling really lonely to actually feeling really useful as someone who's providing befriending to a person in the community who is feeling perhaps like she was at the beginning of it all. She's also engaged in some online activity with Mindspace, and she's looking forward to getting out and about. She's looking forward to enjoying some of the social connections that she's making whilst we're still in lockdown. But actually all it took from the social prescriber was a conversation around what do you want to achieve, and let's have a look at what there is locally. We could perhaps have referred to all sorts of services for anxiety and impending depression and those kinds of things, but actually volunteering was the answer for Sandra. Can we move on one? So we are all about working together. Social prescribing, we're not a huge team. We don't provide a service as such. We don't run any organisations. We don't need any volunteers. We are only as good as what's happening in the communities around us. And we can only work with people who we're told about. So our referrals come from all over the place, from colleagues in primary and secondary care, from colleagues in mental health services. We get referrals from the fire service, from adult social care, from all over the place. And we get some people self-referring in as well. There's a really simple referral form which is available on our website, and you can always just give our coordinator a call. You'll get her number at the end of the presentation. The reason we ask for a form is because we don't have access to clinical systems like System 1 and the systems that the GPs use. So all the information we've got is what we get on that form. We don't ask for a lot. It's not a big, it's just 2 sides of A4, but it's just enough for us to be able to make an initial contact with someone. And then when we've got that information, just to get in touch with you, this is what social prescribing is about, and someone will be giving you a call in the next couple of weeks. And one of our link workers will just to do almost kind of a triage call to see, is social prescribing right for you? Did you even know you were being referred to us? Is there anything that we can do straight off? So if it's just some signposting, we can give them that information right away. And otherwise we can book in some time to start having that conversation about what's important to them. We have got obviously NHS email addresses, so the emails are secure. But if someone hasn't got a secure email address, then the information for referral can just be phoned into our coordinator, so there's no risk of anyone's information, whatever the internet is. Next slide, please. So there's our contact details. Our coordinator is in Monday to Friday, 9 to 5. Obviously our email address is there. There's my contact details there as well. We're always really happy. If you think, oh, I'm not sure if this person's right for social prescribing or not, just give us a ring and we can have a chat about that. We're always really happy to do that. I think that might be the last slide. Let's have a see. Ah, there it is, yes. So I'm just wondering if we've got any questions. Oh, we've got no questions. Either I've been really thorough or people are fed up with my voice. Any questions on social prescribing?
I'm sure you've been very thorough. Thank you, Lisa. That was really interesting. Thank you.